incentivizing people who run a healthcare business is you got to do more, right? You fee for service, you do more, you get paid more. And that underlies, I think, one of the fundamental issues with American healthcare is that it's not incentivized to think about preventing costly care. It's not incentivized necessarily to think about holistic care and all the different types of care you might need, rather than a particular provider, what that provider is able to do for you specifically.
Welcome to Fempower Health. Georgie here. When I started this podcast a few years ago, it seems as though the awareness and discussions around the pelvic floor were minimal. Many of the challenges that women were facing with incontinence, prolapse, and other factors were normalized. But today we have books, we have education materials, new products, and more. And it's really been great to see this evolution. But we still have another problem to address, which is the shortage of experts on the pelvic floor. So today I bring to you Karen Stander of Hinge Health, and she is going to talk to us about the healthcare dynamics and how the impact of this shortage is creating challenges for those who are struggling. But she will also talk about what Hinge Health is doing to try to change that. Karen, it is so nice to meet you, and I'm really excited to connect with you because I've done so many episodes on the pelvic floor, and it's a really popular topic on the podcast. And what I also love is when people start creating technology to make things even more efficient and effective. And so that's really what we're here to talk about today. So why don't you first start by giving your background, and then we can dive into all things pelvic floor and how technology is enabling some of these women's health issues.
Great. Thank you so much for having me. Delighted to be here. So I'm currently the Vice President of Physical Therapy and Women's Health at Hinge Health. We are a digital health company focused on musculoskeletal health, helping people free themselves of chronic pain, acute pain in all parts of the body, including women's health, specifically pelvic health now. My background is in public health. So I've spent over 15 years in healthcare, being at the intersection of business and clinical care. So a lot of folks wanted to kind of go into this field as a clinician and realizing that they wanted to contribute in a business way. But I was really fortunate, kind of found my calling early. I knew I wanted to be at this intersection and not be a clinician myself, because I wanted to impact systems of care, populations of care, and thinking really broadly about how do we improve access and outcomes in an innovative way. So most of my career before coming to Hinge Health about a year ago, I've spent in traditional healthcare setting all across the entire spectrum. I've worked in the hospital side, in outpatient clinics with physicians. I spent 3 years in home care, and then I took some corporate roles thinking about clinical strategy across that care continuum. So I know kind of the brick and mortar ins and outs, all the good, the ugly, and I've led different types of programs across the spectrum, well, from oncology to neurological care, pain management. So I've really kind of seen the scope of that, and that's what kind of really got me excited to go into digital health, wanting to be able to, again, impact large groups of people beyond, just the walls of and footprint geographically, and find really new, innovative ways to deliver care, particularly thinking about all the inequities that people of color face, that women face, wanting to, really develop solutions to help people in all sorts of forms. So delighted to be here and kind of share a little bit with you what we're thinking about at Hinge Health.
That's awesome. And you're speaking my language. So I don't know if you know, but by day, I'm a consultant for the healthcare industry. And I feel so fortunate because I really got so passionate about the startup world and how tech is really transforming healthcare. Because I've been in the healthcare field, mostly working for biopharma companies for over 20 years. And now I do consulting for them. And, our healthcare system is so antiquated and frustrating. Yeah. And, as a consultant, I look at how do we optimize? And what's so cool is technology is kind of forcing the industry to change, especially with these startups. And COVID, I think, is accelerating that. So this is really exciting. And let's just dive in, because I'm so excited to talk about this topic. So, let's talk, perspective on the data around, pelvic pain and all of these women's health issues, because sometimes like we live in our own bodies. And so either we normalize it because it may be a gradual change, or it gets normalized by someone external to us, or it can be an embarrassing thing to talk about. And so I always like to start with, you're not alone. Let's talk about the prevalence. So tell us about this spectrum of what you're seeing, of how common these issues are, and just that whole dynamic of pelvic floor. And I know Hinge Health focuses a bit more broadly on all musculoskeletal, but I know today we're going to focus on women's health. So let's talk about that.
Yeah, absolutely. So one of those things, like you said, totally normalized. And, we talk to our mothers or aunties or sisters, right? Like that happens to me too. You kind of can forget that common doesn't mean normal, right? It's very prevalent, but you shouldn't have to live with it and just be okay with pain or these symptoms. So 1 in 4 women over their lifetimes will develop some sort of pelvic floor disorder, right? That can range from incontinence, pelvic plane, prolapse, a lot of these subjects that I know you've covered in your podcast. So very common, can be very typical around certain life stages. So certainly pregnancy, postpartum, very traumatic to your body, right? And then as your hormones shift and over time, menopause and things like that can cause other changes as well as just your aging body. So it can happen, throughout a woman's lifetime. Incontinence is such a big one, right? Almost nearly 1 out of 2 women. So kind of like a joke, like you're in a room, you look at another woman, is it you or is it me? Like one of us is gonna have that issue, right? Again, can occur like different times of your life, and then even through something like pregnancy, 75% of women experience some sort of musculoskeletal pain. So I'm about 7 months postpartum with my second child right now. Both pregnancies experience lots of actually different ones in each pregnancy types of pain. And then people forget to tell you, they prepare you for labor, but the whole postpartum period, there's a whole host of issues there,
Yeah.
across your entire body. So again, going back to common is not normal, I think it's been easy as women for us to forget to take care of ourselves. Or when again you're talking to your girlfriends, your mom, your sister, like, oh, I experienced that too. It's just part of having a baby, right? Part of aging. You'll never be able to sneeze and not pee again. And and I think that part is what we want to normalize and say, yes, normal. Yes, great to talk about with your girlfriends and your sisters, but let's get help too. It's totally treatable. And there are a lot of accessible and non-invasive ways to take care of yourself.
As you're talking about this, in high school, there was this very dear friend of mine, and she would always joke about how her mom, when she would sneeze, she'd have to
Yeah.
cross her legs.
Yeah.
And we all thought it was funny. Like, none of us
Yeah.
were like, oh, she should probably go to a doctor and get that fixed. It just was a
Yeah.
funny joke that
Yeah.
we told ourselves. So if you're having to cross your legs and you're joking every time you sneeze, let's do something about that. Okay.
Well, well, it's funny. Yesterday, like last night, my husband, I was telling him I was going to be on this podcast. He goes, "I just saw a TikTok where a woman was crossing her knees as she sneezed." The same exact example because she didn't want to pee. So it's now even on TikTok, right? It's something that's going into my husband's algorithm. So I
Oh,
think we're getting
God.
to a place where it's much more normalized.
Yeah.
But I think the part that isn't quite there is the access to care, right? And so I'm sure we'll dive into
Yeah.
that too.
So let's talk about that, because again, for those who want to know about specific pelvic floor issues, I have experts talking about that, and here we'll focus on some of the technology and how you guys support that. But I always, it's funny. I'm curious if those listening to this episode are going to be women struggling who want to understand this, if it's going to be companies who want to better understand how you guys are operating, or investors. So it would be interesting. I do hope women also listen to this, because I think understanding the dynamics of the healthcare system just
Yeah.
further empowers us, right? So talk to us about the dynamics of this healthcare system and the challenges with helping women, and and then we can get into like what Hinge Health is starting to be able to do in transforming that a bit and helping patients who are struggling with these musculoskeletal, and in this case women's health issues.
Yeah, absolutely. So let's start talking a little bit about just kind of baseline, how
Yeah.
the American healthcare system works, right? So primarily people get health insurance through their employer or through government funded programs like Medicare or Medicaid, or they don't have health insurance right now and they had to, buy it themselves off the exchange or these public markets. But primarily most Americans will get it through their employers. The way insurance work is, again, majority of healthcare in the United States is what's called fee for service, right? So every time something is done, whether it's a doctor's visit, a lab, a prescription, someone gets paid for that, right? So if you kind of flip it from the healthcare delivery side, healthcare is a business, right? And even though a lot of healthcare systems or operators are not for profit, it doesn't mean no profit. People get confused about that. They still got to pay the bills, pay the people, pay taxes, etc. So if you think about just economically, what's fundamentally incentivizing people who run a healthcare business is you got to do more, right? You fee for service, you do more, you get paid more. And that underlies, I think, one of the fundamental issues with American healthcare is that it's not incentivized to think about preventing costly care. It's not incentivized necessarily to think about holistic care and all the different types of care you might need, rather than a particular provider, what that provider is able to do for you specifically, right? And so I think that's something that's really key that I think most people don't understand is, again, it's not out of, I think, malintent. I think, medical care providers across America want to do the right thing, but it's the systems of care that,
Agreed.
are creating these, I think, unintended consequences of doing more. So, an adage is, if you're a surgeon, you're going to want to cut, right? Because that's how you make your money. And you don't necessarily think about, well, what are all these 10 other steps we can do to necessarily help this patient who might benefit from physical therapy or maybe steroid injections or different things before going to this very invasive, costly surgery. So I think those are one of the issues with the American healthcare system. I think the second thing is that it's very siloed, right? And even though there are larger healthcare systems now that have integrated care, a lot of care in America is very siloed. So you have your doctor's office, which is its own shop, different than the lab down the street, different than the CVS pharmacy where you get your medications, may or may not have any affiliation with the hospital that you want to go to, or the chiropractor. All these different parts of the healthcare system belong to different entities, have different objectives, right? Are getting paid differently, may not be part of your network or not, and that has different implications for your costs. So a lot of ways that's not coordinated well, and you can understand how, as a patient, that's difficult to navigate, difficult to know what your options are. And once you get care from all these disparate sources, how do they talk to us, right? And then that's kind of a third major problem is, in this day of digital, we have everything online now. Very few practices, medical offices are just on paper, so everyone's on the computer, but there's information, but the information is not connected, right? And sometimes when their information is connected, it's not meaningful, it's not actionable, it's just a bunch of numbers and 20 pages of hard-coded PDF. How do you search a PDF, right? When you're in an emergency room, you need to make a decision right away. You want to quickly understand the history of that patient coming in. So we're in a age where there's a lot of information, but it might not be actionable or meaningful to the providers who are trying to coordinate, and also to you as a patient to figure out, what do I do with all this and how can I utilize this to serve my healthcare goals?
So practically speaking, if I'm having like these women's health issues, and let's be specific to what Hinge Health, or even you can speak more broadly, what are the impacts to, let's break down general population, and then let's talk about the underserved populations as well, because that's a different dynamic that I want to speak about, because I've been dying to better understand it because of some nuances of technology that they may not have access to. So from a general population perspective, what are the challenges people practically, on a practical level, face?
With women's health, the latest stat that's going around, which is really unfortunate because there's such an attention to, lack of reproductive health around the country nowadays, right? Is in half of the counties in the United States, there isn't a single OBGYN. That's really alarming.
There is not an OBGYN? Did I hear that correctly?
Not a single OBGYN.
Okay, there's one. Okay.
Counties, yeah, in America. So, and it's particularly in the South and the Midwest, right? So that's really scary, I think, as a woman or just someone who thinks about women's health more broadly. right? So is your average primary care in those counties where you don't have an OBGYN able to think through holistically all the needs of women, right? And that primary care physician in particular is probably overloaded, right? If there aren't all these other providers. And I think it's a trend that we've been seeing, decade after decade, especially with new grads coming out of medical school. They're tending now to concentrate in large urban areas, right? So really across America, the rural, more geographically isolated areas they're getting less and less care. So if you're women in just those areas, if you can't even get to an OBGYN, like what are the chances that you're going to have a provider you can talk to about all these changes that are happening to your body, and one in particular that really understands pelvic health. Even within the OBGYN and community, there can be a lack of understanding of, the referring to pelvic health, floor therapists, for example, when necessary. Again, but kind of back to the way our systems are built, after you have a baby, you have a 1 6-month postpartum appointment, and that's it. It's kind of like good luck, right? And so I think a lot about women in those parts of America who just, without an OBGYN, and even if they do have one, where do they get access? So I think holistically and across the broader women's health population, those are the main issues, is just having access to a provider who understands, and are you able to see them enough to really get to the root of, issues that you're experiencing.
How is Hinge Health helping? And
Yeah, so let me tell you about what Hinge Health does and kind of our take on addressing these access and inequity issues for women in particular. So if you're not familiar, or your listeners aren't familiar, we are primarily an employer benefit. So employers from large Fortune 500 companies to actually small and medium businesses across America, across industries. We have tech companies, we have manufacturing companies, we have teachers unions, the whole breadth of all types of employers. They buy us as an employer benefit, right? And they trust us because we deliver a return on investment. So members of that, our clients, the employer's population, can sign up for Hinge Health. They fill out a questionnaire, and we focus on musculoskeletal pain throughout the body, whether it's chronic in nature or more acute, for every part of the body, including women's pelvic health right now. And so, to the employee of this company, we are access that doesn't require copay, right? Because their employer has already purchased us as a benefit for them. So to the employee, we're 100% free. It's convenient. You can do this at your home if you're traveling for work, on vacation. Everyone has their device with you. We offer a tablet, so that's how we address the tech issue, the lack of tech issue. We can offer a tablet that's connected over Wi-Fi for that, and we pair you with a comprehensive care team. We truly believe that addressing pain and musculoskeletal health as a whole comes best from a coordinated care team. So that care team for us includes a health coach, physical therapist, and we also have a team of physicians, surgeons, nurses in the background who can all come together and figure out the best plan for that patient. So in women's pelvic health in particular, that is a pelvic floor physical therapist. And so I know you've had a number on your podcast, so they're specifically trained in this region. And we've kind of, I think, what's been really exciting about this program is we are really pushing the edge of innovation in terms of how to deliver pelvic floor care therapy virtually, right? Without internal examination, which a lot of women find invasive, frankly,
yes,
right? And there are so many barriers to getting care in person, right? I remember my own journey in trying to find a pelvic floor therapist, and let's fast forward through all the access issues and kind of figure out outside. But like once I got to one, there was only one appointment available to me. Otherwise, it was okay. The next available booking is 2 months from now, and so I was a couple months postpartum at that point. I'm like, oh my gosh, who's going to take care of my baby while I drive over to this appointment? And I'm on a pumping schedule. I was exclusively pumping with her, and how do I fit it in within this 3 hour window and come back and then pick up my toddler from daycare? So there's so many barriers in terms of transportation and getting to a pelvic floor therapist. So we try to eliminate that by basically having the PT in your pocket. We kind of call it, right? Like through the tablet or the phone, you can do that virtual appointment. It's convenient. It's kind of whenever you can squeeze into your schedule. The health coach really comes in, and I'm not sure if you're as familiar with the kind of the health coach, or maybe some of your podcast listeners are, but health coaches are experts in behavioral change. Why is that important when it comes to chronic care, chronic pain, or just type of pain? We know that in healthcare, it's a big problem is just kind of getting to care and kind of figuring out what is the diagnosis, treatment, and what's the solution. It's a prescription, it's a form of therapy, whatever it is. But that adherence part is also really important. I think underestimated. We don't think about a lot, right? So our take is that we really believe that change comes when you actually integrate that behavior into your life. And for chronic pain, it's not just doing a couple exercises here and there and you're done, you call it a day. It needs repetition, right? That movement needs to be part of your life. You need to integrate it into a habit so you have that long lasting impact on your chronic pain, and you're continuing to strengthen over time. So that's why a health coach is so important to our model. It's not, anyone can give you a list of exercises to do, right? To diagnose and treat and say, here, do this. But how do you actually do that over time is what's key, and what's driven our clinical results. And so a health coach is specifically trained in understanding behavior change, how to develop habits, to really work with people one-on-one, understand their internal motivations, figure out what barriers there are to their life. And in particular, as we think about a diverse population, what are some of the different cultural beliefs or religious beliefs you might have that impact how you think about your body, your health care, so that you can integrate that movement and those exercises and what you need to do to keep yourself healthy. So it's really a holistic approach for us, musculoskeletal pain overall, but also in the specific lens of women's pelvic health, knowing that, you know, half the problem is accessing getting there, but once you get the diagnosis and treatment, here's the plan, you got to do it, right? And so we
Yep.
pair you with someone who's going to help you keep accountable and figure out how does this work into my busy life and what's going on, so that I actually end up following through on this plan of care and I'm successful.
How is it that the physical therapist or the physiotherapist are able to guide you from the pelvic floor perspective? Because in interviewing so many, like for example, I interviewed Allison Shirkande twice actually. In the last episode we did together, we compared these at-home pelvic floor devices. And one of the things that she was talking about is how you really need that internal exam to figure out the root cause of the pelvic floor issue. And so how does someone like get guided over the internet?
Our philosophy is that a lot can be done virtually, and that's what I go back to. We're really trying to push the edge here in terms of innovation in care delivery. There is definitely a place for in-person exams and pelvic floor trainers, right, to get that tactile, that feedback, but we don't believe it's necessary for 100% of all women going through pelvic floor disorders or needing help, right? We
Got it.
think we can do a lot in having a very thorough whole body approach, which relies on a very solid kind of objective and subjective examination by the pelvic floor therapist. And we've worked a lot with our pelvic floor therapists and our urogynecologists, medical directors, to really be thoughtful about how do we transition our, what's traditionally done in in-person care to digital health setting. So it's not as simple as here's a webcam, Georgie, like do what you did in clinic. It's we have been really thoughtful about every component of that. And thinking about pelvic health, it's not just the pelvic floor muscles, right? It's the abdominal, there's hip, there's lower back. And so there are a lot of things that the pelvic floor therapist can actually diagnose and understand and assess about the patient through the virtual health setting. So we found that we've been able to accomplish quite a bit. Our patients really enjoy the convenience, the access, the comfort of doing it in their home. And a lot of women just don't want the internal exam. So we want to honor that and still be able to provide as much support as possible through our means. And there will always be a subpopulation, of course, that will need that extra step, right? And then we'll coordinate with a in-person provider to make sure that they get their care.
I guess then there's two populations I'm thinking of: those who don't have a job and those who can't get tech access. Like, so is this right? I mean, today because you're also a startup. And as a startup, I know you have to focus on your minimum viable product, get that right, and then you can expand. So I totally get that. So maybe it's a vision rather than current state. But I'd love for you to talk about those who truly have limited access. Because, when I first started this podcast, we would talk about all these things and these technologies and all these really cool things and the subspecialists. And after a while, I'm like, in every episode, we need to talk about access to care, because I feel like half the things we talk about, you need to have, $400 per doctor visit cash to be able to cover the out of network doctor, because the subspecialists usually don't take insurance, and it just becomes this whole web. And I feel like sometimes when I talk about these topics, it's, oh, so listen to Fempower Health and I'll help solve your problem if you have a ton of money.
Yeah.
So maybe you could just address what you're seeing there, and just considerations, whether it's future state or current.
Yeah. So you're right, Georgie. So currently, our main channel is through kind of employers, right? So if your employer doesn't offer Hinge Health, or you don't work or have insurance through that, then obviously that's an issue. I think longer term, we would absolutely love to be a broader kind of mass market solution, and to help people address pain. Fundamentally, when you shift things, and again, I've seen this in my career through managing kind of like brick and mortar care to now digital health, like there are a lot of efficiencies in transforming to a digital health setting, right? Like just basically like you're not paying for the building, the rent, all of that. And so we can dramatically decrease the cost of care by offering it through a digital health setting. Secondly, there's such a maldistribution of providers, right? So pelvic floor therapists, for example, within 10 miles of San Francisco, I live just outside San Francisco, I could find probably easily 15 pelvic floor therapists, right? A couple weeks ago, I was in Nebraska, where my husband's family from, and I'd have to go 100-mile radius of Omaha, which is a big city actually, to get that same access to, a dozen or so pelvic floor therapists. And that's not okay, right? Like those are, again, Omaha's a big city too. So through digital health, we can kind of aggregate the supply of these specialists who are across the country and offer them a means of delivering care in a more efficient way. And that helps at the end of the day reduce the cost. Right now, the cost is to, again, our clients are employers, but we hope that over time we can, democratize that and offer that in a mass market solution. Secondly, I think the other piece outside of just getting care from a physical pelvic floor therapist is the education component, right? And so I think there's a lot that we want to do as a company in providing education to the broader population, helping them, at the very least for women's health, there's so much stigma and kind of just a lack of knowledge around that, illuminating that so that women can be advocates and access, what they can for, within their means.
Okay. What I'm also wondering is, because of all the different aspects of the healthcare system that you worked in, is how you're seeing a transformation. And I guess I wouldn't even be able to pinpoint the transformation, but I guess what I'm getting at is like which specific aspects. But I guess what I'm getting at is, you started this conversation where doing more is how the system is set up to be incentivized. But we also know that costs so much more money than prevention.
Yeah.
Additionally, this is something that's employer sponsored, not through healthcare insurance. And there's a ton of startups. Like I know Carrot was early on, they were kind of like the quote unquote insurance provider for infertility services. They were probably one of the first that I remember seeing that kind of moved into, and then obviously every single startup has gone to the employer benefits. So I've been watching the trends and how everyone's been evolving. And so where do you see the impact on insurance companies and what they're starting to do? Do you see people are finally getting that even though people are incentivized to do more, in the long run, it actually hurts everyone? Like, where do you see things happening now, and what do you predict for the future?
Yeah. So we are overall in the industry seeing a shift more towards value-based care, right? Which is this concept that you need to balance cost, quality, and ultimately the patient experience. And that can be done through a variety of ways. One concept is, essentially paying for a bundle or paying for outcomes, right? You're getting paid for one outcome, and however you decide to get to that outcome, right? Whether it's, through preventive care, less invasive care, et cetera, is ultimately kind of the decision on the provider. And that helps incentivize value for the patient and bring costs down. We're seeing health insurance and payers move towards that direction. It's been, a long time coming and still very slow. Um, what's accelerated is Medicare, right, biggest payer, government funding, has introduced a lot of kind of experiments around value-based care. So that then has spurred providers, healthcare providers, and payers to pay attention and say, oh gosh, we probably should do that too. And large employers also have a hand in this, and kind of thinking carefully about their costs and building their benefit policies. Or if a large employer is self-funded, which means that they take all the risk themselves, they can construct their benefits in a way that incentivizes preventive care by, for example, not having co-pays or co-insurance for your annual checkups or certain labs and things like that. So it's moving in that direction. Probably like not as slow as we need to as an industry. Hinge Health is also, I should say, partnering with health plans, right? So we are working with them to say, hey, include us in kind of the package of services that you cover, because we again have a demonstrated clinical return on investment in terms of if your plan participants are doing our program and managing the chronic pain, then they're not ending up getting steroid injections, getting very costly invasive surgeries, which then leads to rehab and all these unfortunate outcomes. So I think payers are more and more kind of recognizing these novel solutions that are enabled by technology, and recognizing that you can deliver all this type of preventive care and just kind of innovative care using sensors, computer vision, all the kind of tech, the shiny tech parts that we offer, and get those outcomes.
Now, speaking of the tech part, did I see correctly on the website that patients can put on devices so
Yeah.
that we can double check that they're doing the exercises properly? Can you talk a little bit about that?
Yeah, so we have kind of three cool pieces of tech that we are weaving into our programs and services. So one, as you mentioned, is the sensors. So they offer real-time feedback. Let's say you're doing lunges, right? So you can put those sensors on, and in real time on the app, it'll tell you, no, you need to kind of bend more this way or move that way. So you're doing your exercises correctly. So that's kind of part one. The other part, which is I think super cool, is computer vision. So we're integrating computer vision, which is sensorless. It's looking into a camera on your tablet, computer, or phone, and that's sensing where your joints are to add to that real time feedback. So in places like pelvic health, where it's like, what are you gonna do? Put a sensor in your you're not gonna put a sensor there, right? It's gonna give you real time feedback of how you're moving your abdomen, and in different parts of your body. And the third piece of technology that we have a FDA regulated device called Enzo. It's non-invasive electrical stimulation for pain relief. So really cool. It's been helpful for women with endometriosis or really bad menstrual cramps. And it's like a patch you put it on, very similar to a TENS unit if you've ever used one
Yep.
before.
My son uses the TENS unit. It helps for endo and period pain.
Yeah. So
Interesting.
really cool. So we can assess if that's necessary for that particular patient and add it to the care that we're providing. So really cool ways of pairing. How do we think about movement? How do you, again, back to that adherence, right? You got the habit formation down. You're working with a health coach, but like, are you doing the exercises in real time? It's similar to the feedback that you get in an in-person PT clinic, but again, at your home in convenience and tailored to you.
Okay. Now I'm curious if you've seen this from your perspective, because I know, especially as a startup, you really have to laser focus. One of the things I'm wondering is, do you see challenges with the consumer or even the healthcare provider and maybe even the payer struggling with so many? Because as these startups, you guys have to focus and get really good at what you're doing. So, if you're the company that is, storing sperm, if you're the company that's doing pelvic floor PT, or like Maven, they're focusing on. So I could just see how being siloed, the now consumer or the payer, the company who's choosing benefits will now struggle in weaving through that. So I'm just curious if you've seen anything there, any challenges, and how people are overcoming it, or if it's just something that's the next phase of figuring out in our healthcare system.
Yeah, that's a great point. I think, over the last 5, 10 years, there's been a plethora of companies entering just like you said, the employer benefit space, right? So what we're hearing from benefit leaders, from, health health benefit consultants that we work with, health plans, is that, gosh, the space is getting really crowded, right? And we are less interested in, number one, solutions that aren't clinically valid, that aren't proving an ROI, because everyone can kind of like make up their stuff. But when you have peer reviewed journal articles, when you're validated by third parties, right, that's what they're really interested in. Secondly, they don't want just kind of point solutions. And so that's why it's so important that our services are all under one program, one app, right? So you don't need a different service for your women's pelvic health. You don't need a different app or a different sensor for your acute pain or your back pain, versus this and that. I think employers are looking to, ultimately like kind of consolidate all the different vendors that they have. So it's kind of I think that's the next wave. I would say secondarily, right now, it's been the past 5 years has been an especially frothy time for digital health in the musculoskeletal category alone, kind of quite crowded. And I think as capital markets are tightening, in this, whatever you call it, this recession is like kind of tightening up of economy. A lot of companies aren't just going to make it past that, when they don't have true clinically validated solutions that integrate nicely into what the employer is already offering. So that's why it was so important for us to implement, we call it Hinge Connect, which is our integration with EMR. So, in the beginning, I talked to you about the problem with data and having like a lot of information, but it's not actionable. We are integrating electronic medical record data from a number of providers across the country so that we can kind of figure out in real time, does this patient also getting an MRI, of this patient got prescribed opioids? We can intervene and connect with that care that they're getting so that we're not just a point solution that's living off on an island on its own.
So tell us about the results. I mean, clearly you're going to have to demonstrate results to be able to have more employers want to leverage you and to be able to figure out how you all can improve your services. So I'd love to see, the impact that you're having and even the feedback that you're getting from, your audience. And it could be the employers, the employees. Tell us what you're demonstrating.
Yeah. So our women's pelvic health program is pretty new. It was developed through a lot of active feedback from our clients and even prospective clients, and wanting more of a solution to address their diverse population of women and all the needs that they're serving. So it's since we announced, it's been ecstatic. We've had, clients and partners say like, please sign me up first. When can I get early access? Like our women are craving this. And I feel like, especially when the person in the conversation is a woman, that benefit leader or whatever, like I always get an email afterwards, or call like, Karen, like this happened to me too. And I wish I had this. Right. So I think we found a lot of resonance with what we're trying to offer, because if you've been in those shoes as, the woman who's trying to like cross her legs while she's sneezing, so she's not peeing, or like the postpartum mom who, can't get childcare for just the pelvic health therapy, you get why this is needed. So we found that to be really ecstatic, and we're still in the early days of this product rolling out across all our clients. But even internally, the clients that we have are like, raise my hand, I want to go first, right? And over time, we will look forward to publishing, again, clinically validated, third-party verified results, just like the rest of our program. So, for example, we've seen our Medicare population, which is a population you think that is not as in tune with, using technology. We, still have better outcomes than in-person therapy in using our program with a combination of health coaching. So we think that, we do have the right recipe, right, and how we've thought about our program and all the components of coordinated care to deliver very similar, outstanding results.
That's awesome. And it makes so much sense because I have hypermobility disorder syndrome, whatever you want to call it. And I look back in my life and I'm like, I've been to PT a lot. And I finally had someone diagnose me. It was actually a girl I went to high school with. I was in San Francisco doing a consulting gig, and I made an appointment, and I'm like, hold on a minute. I went to high school with her. So she was my doctor, and she was unbelievably outstanding, like more thorough than anyone I've ever seen. But you're right. Then I just went off to PT. I just got a prescription, go to PT, and that was it. And so thank goodness I'm very obedient and I listen to instructions. But there wasn't like further follow up, and no one was triple checking. And, I can totally see how Noom is the app, right? Am I thinking of the right name? Like they're using a lot of the cognitive behavioral therapy to make sure people are sticking to their plan. Yeah. So, this is so, so great to see.
I think one of the challenges we face is, similar to what you said about being laser focused. There's so many problems to solve, right? And I think we get excited, our clients get excited about the different paths we can have forward, right? Why don't you also do this? Oh, Hinge Health, we trust you with our client population in addressing their pain. Can you also do this? So it's easy to get distracted, but we want to do this really well and just be laser focused on addressing this mission. So right now for me, it's seeing us through with women's pelvic health, delivering the best program possible, having the strongest clinical results, the highest level of satisfaction. I have no doubt that we will have other paths we can take as a company, but it's always the fear of missing out, right? Like, this sounds sexy, this sounds fun. Our clients want us to do this. We can go in a lot of different directions. So
Okay.
I think it's a good problem to have.
That's awesome. So, what would you want people to take away from this discussion? And I mean, I could see this being women who listen to this and say, oh my gosh, my employer seriously needs to do this. It could be, again, lots of different folks listening. So, what would you want people to take away from this conversation?
I know you talk a lot about your podcast about each woman feeling empowered to make decisions for herself. And I think that's so crucial. I'd love to see us as women help empower each other and advocate and look out for each other. So when it comes to addressing these systematic issues in healthcare, right, and recognizing that a lot of women don't have access, a lot of women don't have awareness, how can we help other women get there if we ourselves are empowered? And so that could mean something like, if you are in a position of power to influence the benefits of your company, to get coverage for innovative solutions, right, speak up. Or if you're not in a position of power, but a lot of companies have those annual benefit surveys and you're filling it out, these are our needs, right? Talk about that. Talk to your leaders about how this can really change lives. It really changes lives when you don't have to worry about your chronic pelvic pain, right? You're present, right? If you're an ad executive and you're scared to make that client meeting because you have incontinence, like, that is time that goes back to the company, allows women to be more fully present in their lives. And so I think we can do so much if we advocate for each other and support these systems and allow women to get the care that they need.
Well, I have had so much fun nerding out on the healthcare system and all the things we need to do to improve it. And it's great to see the impact digital health is making. And thank you all for focusing also and adding this layer of women's health and the pelvic floor, because it is, again, like, people download these episodes like crazy. So it's clear that it's an issue. And I'm so glad you guys are working to solve it. So this was so fun. Thank you so much.
It's an honor. Appreciate having me.
Thank you for joining me today on Fempower Health. If you'd like to continue the conversation, please follow me on social media. I am most active on Instagram, LinkedIn, as well as TikTok. You can also subscribe to the weekly newsletter if you want to stay off social media to get the latest and greatest updates. And you can find a link to that either on my website, fempower-health.com, which is a hub to all the different health topics I've covered over the past 5 years, or you can go to the show notes where there's links to all the helpful resources that are relevant to this discussion. And if you know of someone in your life who would benefit from this information, please do pass this along, because that is how we can ensure this important information reaches those who need it most. And for anything that is discussed medically, please understand that none of what we share on Fempower Health is medical advice. It is all for information purposes only, and only a conversation between you and your doctor can give you the care that you need. Thank you very much.